Hey everyone, I'm Lisa Jedan, and welcome to MenoPositive,
I got a good feeling.
where we take a refreshingly positive approach to navigating menopause. If you're looking for practical tips, expert advice, and honest conversations, think of this as your personal pick and mix for how to optimize your body. Although we can't prevent menopause, we can redefine it. And that journey starts now. As we step into a new year, there's a lot of noise out there, isn't there? Vision boards, resolutions, manifesting, new year, new you energy. But as we exit the year of the snake, instead of asking, what are you adding this year? I want to start with a different question. What are you shedding? What are you finally ready to leave behind? Because for so many of us, I don't know if you feel this way, but there's like a quiet tiredness, right? It comes from carrying too much expectation, too much guilt, outdated beliefs about aging or pain or discomfort that is quote unquote normal. So maybe this year isn't about fixing yourself. Maybe it's about freeing yourself. How do you want to enter into the year of the horse? With confidence? Curiosity? I believe this is another pivotal year for women's health. A year where conversations that have been living in the shadows, you know the ones, about hormones, menopause, mental health, intimacy, energy, ambition, they continue to take center stage. But more importantly, I believe this is the year you step out of the shadows too. The year you stop outsourcing how you feel. The year you start listening to your body instead of fighting it or ignoring it. The year you take care of yourself as a priority. And if you thought the Spice Girls had the monopoly on girl power, I can't wait for you to listen to today's episode. We're speaking with Laura Dowling for an honest, bold, and empowering conversation about vulval health, hormones, and menopause. Laura is a leading health advocate with over 20 years' experience in the field. You may know her online as the Fabulous Pharmacist. Drawing on her work from behind the pharmacy counter and her best-selling book, Love Your Vulva, today we're sharing menopause confessions, the things women are too embarrassed to ask their GP. Laura, welcome to MenoPositive.
I love the name of your show.
Thank you. It's all in the name, right?
Listen, absolutely. And I love the idea of, everything you've just said, the year of the horse is pivotal for women. And let's all start by embracing our intimate health, isn't that right?
Well, exactly. I think there's so much information out there right now about brain health and bone health and, heart health and muscles. And I was like, okay, we got to do an episode on the things that nobody is really, really talking about, like our vulval health, because also it's more important or just as important to our optimal health as everything else, isn't it?
Absolutely. And I don't think people actually relate their intimate health to their overall well-being, their cardiac health, their mental health, because we see it as something separate to it, but actually it's so much a part of our day-to-day life. If we have incontinence or leak, it means that we are less likely to exercise to our full capacity. If we have prolapse, it means that we can be uncomfortable and not walk around, not exercise either. If we have vaginal dryness, it may affect our ability to have enjoy sexual intercourse. So it affects an awful lot of our day to day. It can affect our confidence and it can affect our sense of being a woman as well. And unless we actually give these things names and give women solutions as to how to help themselves, we're going to, stay in the dark ages.
And this episode, I wanted to be like, why didn't anyone tell me about this episode? Or why didn't they teach us this in school episode? So
Oh,
you have
yeah.
free range today, Laura. You have absolute free range. And not only are we going to talk about this, everybody, but Laura is going to explain it to us, but she's also going to say that you don't have to put up with any of the symptoms. She's going to tell us what you can do about it. And she's also going to tell us what happens if you don't look after it. And I think that's just as important.
Absolutely, without scaremongering women. But I think the important thing is that women should know that there's absolutely no shame with any part of their bodies, and that there is absolutely help for every single thing. We may not get you back 100% the way you were when you were 16, but we can get you pretty close, and we can certainly get you more comfortable and
And
more in love with your body.
now you talked about shame, and I think there's been so much shame around our vagina, around, I mean, the whole I'm gonna let you talk about the anatomy in a minute of it, but, you have built a career answering the questions that women stay up till 2 o'clock in the morning Googling, you know, or that they whisper and have whispered to you over, the pharmacy counter. But, like, why do we find it so hard to talk about our intimate area?
I think there's a number of reasons. I don't think women's health was ever at the forefront when it came to medicine or medical research. Women were seen as less than men. So your typical body that was, researched in medicine was your average man, okay? And everything stemmed from that. The word hystra is actually the Greek word for uterus. So hysteria comes from that. So, let that sink in. It just, and because of that, then we were never encouraged to talk about our bodies, the specific different bits of our anatomy either. There's a deep sense of religious shame as well. I grew up in Catholic Ireland, but it doesn't have to be Catholicism. It can be any kind of religion. We women have not been encouraged to discuss their bodies in the same manner that, say, men may have discussed them. And we were certainly never given the language or allowed to speak about them, even just from their basic terms like vulva, vagina, labia majora, labia minora, clitoris. We're never taught in school that the clitoris is the only organ in the human body, male or female, that was purely designed for pleasure, or that clitoral stimulation is often the way many women will orgasm, not through penetration at all. And we're not taught this. So how can we, launch into relationships and know what the best thing is for ourselves if we're not even taught this about our own bodies? So I'm just about ditching all that and learning and absorbing.
When you were young, did your parents have a different name for your vagina?
Yeah, we called it our muffin.
Your mo
I know.
My
And
mine was like
apparently
mine was a popo.
Popo.
A
Wow.
popo.
Where does that come from?
It could have been, I don't know, my parents were German, so
Okay.
I have no idea, I don't speak German, but
Okay.
it may
So
be
ours is
completely
a
unrelated.
muffin.
A
And I don't
muff
know why it was a muffin, but apparently when I was very young, Dad was talking about eating a hot buttered muffin, and I looked horrified. But we still kind of called it that until I was well in my 20s, and I was meeting people in the pharmacy every day, meeting women that couldn't describe the different parts of their anatomy and what was going on with them. So I made a resolution with myself to use the proper anatomical terms. So yeah, it comes from childhood as well, and it's that babification of our bits. Like, we don't have a different name for our elbow or our knee, but yet one of the most important parts of our bodies, we call it our Mary or our Betsy or our muffin or our popo, instead of just using the correct terms. And
Exactly.
and the thing that I have about that is that if we teach little girls and little boys, of course, the proper names, it means it just ditches the shame. They're able
Yeah,
to talk about it. If they have an itch down there, they can say, my labia is itchy. If someone touches them inappropriately, they're much more inclined to actually tell someone. If they are just taught this is another part of your body, even the fact that we call it our private bits, it's just like, call it what it is.
yes, yeah, and just use the medical term for it, and then it
Uh-huh.
will help normalize it a little bit. But I think, yeah, they talk about it, I think in school, they're talking about it, for periods and babies, um, but not really that this is actually a really important part of your body, and it's going to change, especially during the menopause transition.
Yeah, yeah. And
And
even pregnancy and postpartum, it changes an awful lot too.
well, I think from puberty all the way through, like, when I
Yeah.
was reading your book, like, I mean, everybody gotta go buy the book to get those bits of it. Today, we're only gonna we're gonna talk about the perimenopause, menopause bit. But I also love, I think in your show, Viva La Vulva, which is your live show, you said something in your book that you say to women, like, if you had to take a picture of your vulva and I hung them up here, would you be able to identify your vulva in a lineup? And most
Yeah, I
women
say
wouldn't.
that. Yeah, I know. I say that to, like, so I have a show coming up actually on January 31st. So we have like 2,000 women in an arena, and we're going to say to them, if you stepped into a photo booth and took a picture of your vulva, and that was your ticket into this show, and we hung them all up, who would be able to pick theirs out in a lineup? And sure, no one can. But if you ask the same question of men, of course they'd be able to. So they're intimately acquainted with their
Yeah.
bits. So yeah, so it's important for them to get everyone to get a mirror out and have a look, because actually, if you know what your vulva looks like when it's healthy and well, then you're much more inclined to be able to understand when things are going wrong and when you need to when you need to go for help.
Well, and I kind of, drew a parallel with breast exams because I think they say the same thing, right? The more familiar you are with your breasts and the more, you will be aware when there are changes in it. And then I thought when you were talking about, like getting more familiar with your vulva, I was like, it's the same idea, isn't it? So you can notice these changes.
Yes, absolutely. It's really important, and it just means you have a starting point. You have a baseline to start from, so you know what it looks like. Check it, once a month. Make sure everything's still intact, everything's still there. Because what happens is, as women go through their hormonal stages in their lives, and specifically perimenopause and menopause, your labia can dry, it can shrink, it can atrophy. Your vagina can also get dry. There can be skin changes, but more importantly, there can be structural changes due to diseases such as lichen sclerosis and lichen planus, and that can cause permanent damage to the vulval and vaginal area that's really difficult to rectify once it's gone so far. So if you're looking for symptoms or looking for irritations and you go and get it seen too quickly, you can stop it in its tracks and just manage it. So it's really important that women understand that it's not too embarrassing to go to a doctor and get help. And if your doctor doesn't know what to do or you're just being fobbed off, ask to be referred to genital urinary medicine specialists, because they, although people often relate genital urinary medicine specialists to STIs, they see everything, all kinds of genitalia, and they can really pick up on any kind of an issue and put you on a proper management program.
But I think, there's another idea here that you can enlist your partner. I mean, if you have a partner, you can enlist your partner as well as in this exercise. I'm sure my
You absolutely can, although I don't know how that exercise might turn out. I'd say some partners might get overly excited and,
Yeah,
and forget what they're there to do and just want to start doing something else. So
maybe.
it depends. It depends on how enthusiastic the partner is.
Yes, that is true, that's true. But how amazing that it's an organ that we can actually see, and I also learned from reading your book that no 2 vulvas are alike. They're like snowflakes. I love this
They
idea.
they are unique and they are beautiful. And that's why I have such a problem with, I suppose, the barbification of our vulvas, which is very much happening where we're talking about labiaplasty and vaginal rejuvenation for the sake of aesthetics rather than for function. So, absolutely, if someone needs surgery and a tidy up because they are uncomfortable and sore and they can't get, that's important. And look, anyone can do what they want to do, whether it's for aesthetic or functional reasons. However, I think a bit like our faces and Botox and filler, it's been shoved down our throats that now our vulvas have to look perfect and symmetrical and hairless, just like they do in porn. And as a result, we have a generation of young women and older women that think that they're broken because their lips hang out a bit long, or they're asymmetrical, or they've got a big hairy bush, when in actual fact, that's the way we were made, to have pubic hair, which is protective of the vulval skin. It helps reduce friction during intercourse. Like, it's there for a reason, it serves a function, but yet we're shaving it and raising it all off. It's unbelievable what we are doing to the female body.
Yeah, and I had learned I was at a health optimization summit and somebody was talking about that the pubic hair and why it was there and what it did to actually protect, from disease or bacteria or whatever it may be. And it made me change how I look after it because I have a teenage daughter as well. And if she sees me walking around, I didn't want her to think that, having it nude or naked was normal either. So it made me really
Oh,
rethink it as well.
yeah. Can I tell you something actually? I did a talk for 4,000 teenage girls during this, just at the start of the year, down in Wexford, and I asked them. So it was this massive arena. It was for like teenage girls 15 and 16, and I asked them. I just put it out there. I went down with my vulva puppet and I said to them, "Girls, how many of you, just put up your hands? I want a show of hands. How many of you think that your pubic hair is ugly?" And I swear to God, about 99% of them did, right? This is 15, 16. And then I asked, how many of you remove your pubic hair or want to remove your pubic hair. Same amount of hands went up. And then I said, and what about boys? Do they need to remove their pubic hair? And nothing. And the girls come up to me after that and they said, actually, I'm angry now that I think about that. So and I know it's really hard to change how we've been living for many, many years. You're waxing, lasering, shaving. It's just a done thing. Yeah. And I like a tidy up myself. But in order to erase that, we need to start making those young girls see that actually this is unnecessary and the patriarchy is well and truly there.
Yeah, down in our bits. They need to stay out of our bits.
Oh, yeah.
But did you bring your puppet?
I did.
Because I thought we could kick off with a quick anatomy lesson. Look at that. Look at that beautiful thing.
Isn't she lovely?
Isn't she lovely?
This is my vulva. Now, mine doesn't look as beautiful as this. She probably isn't as plump, but this one comes everywhere with me, even to Tesco's.
You can wear it as a hat, maybe for like
Do you know what?
ascot.
And people say to me that it looks like it looks like a slipper. So I think I could start a new business venture.
Yeah, I think there's merch. There's merch for the Fabulous Pharmacist.
I think so.
Yeah.
I think so, yeah.
Why don't you give us a quick anatomy lesson before we jump in?
Okay, so this is the vulva. So we would normally have referred to this entire area as the vagina, which is interesting because we never mix up the penis and the testicles, do we? But we tend to call the vagina this whole thing, when in actual fact there's so many bits to it. So this is the labia majora out here, the labia minora, which is the inner lips, which either they can hang out a little bit or they can stay in. Then we have the clitoral hood, and then we have the clitoris. Okay, so that's there, that button there. So people just need to learn how to rub that. And this is not to scale, obviously. It's very big. The normal clitoris isn't that size, but a blind man could find that clitoris, couldn't he?
We're definitely going to cut that as a clip for sure.
He may not be able to know what to do with it though, but he could definitely find it. Yeah,
I hope so.
And then there's the vagina in there and the urethra there, just between the opening of the vagina and the clitoris. But that is our beautiful vulva, okay, with our vagina on the inside, the tunnel. So it's nothing actually to do with the outside. So the external genitalia is everything to do with the vulva, and the internal is the vagina. And it's important that women understand that, because anything can happen to any part of this area, and even women don't understand that, say, during perimenopause, when estrogen levels drop, our clitoris can shrink. Okay, so what effect does that have on our lives? Well, it can affect our ability to orgasm. So not only is our libido reduced, which is our sexual desire, when we actually do get it on, we can't orgasm because our clitoris has shrunk. Now, I would often say, can you imagine if 50, so this can happen many, many women. So 80% of women will suffer from some form of genital urinary syndrome of the menopause, and we'll go into the symptoms there.
80%. So I'm just going to stop you there.
80%.
Yeah. So 80% of women will suffer from some kind of genitourinary syndrome during the menopause transition.
Absolutely. And then beyond it, because the estrogen doesn't come back. So they will live with those symptoms for the rest of their lives unless we replace that estrogen or give them soothing vaginal creams or whatever.
So did everybody hear that? Sorry,
Yes.
because I want everybody to hear that. Like, if you don't do something about it, you will live with this for the rest of your life. And I always think, like, if menopause is happening around average age 51, there is still a lot of living to do, right?
We have a third of our lives in post-menopause, basically, these days, because we're living so long.
So girls, turn up the volume, like put down the dishes, like whatever, stop what you're doing and listen to Laura. Okay, sorry, keep going.
Yeah, no, but it's so important, and I'm glad you did stop me there, because when you consider it, if 80% of women suffer from some form of issue down there, whether it be vaginal dryness, sexual dysfunction, clitoral shrinkage, urinary tract infections, pelvic organ prolapse, any number of things, right? And they haven't even heard of that, or they don't know that they can get help. They do live with it. And when I talk about clitoral shrinkage, can you imagine if men's penises were shrinking in midlife?
Be like a national emergency.
Well, this is it. And I just think that because women have been seen as passive actors in their own sex lives, because men do it to you as such, and we're not taking away from the fact that many of your listeners may be gay either, and in female relationships, but in general, it's just taken that sex is done to women, yeah, and like the penis is the most important thing. But if our clitorises are shrinking and we can't orgasm and our desire for sex is low, our confidence is lowered, our relationship can be affected, and just everything. So it's just so important that women understand that your clitoris may be shrinking. You may have an inability to orgasm at the minute, but a little bit of vaginal estrogen cream can help plump that bad girl back up again, and you'll be good to go in
And
no time.
and listen, while we're on that, because I know there is a lot of concern from women. I mean, we know all about the Women's Health Initiative study and what that has done in terms of, baggage around the cancer risk. But I always find it really fascinating that, many women had no problem taking the contraceptive pill, right? But they really struggle with HRT or vaginal estrogen. Did you see that a lot when you were practicing as a pharmacist, or do you still see that now?
Oh my God. Like, the reason that I do what I do is because of that WHI study has done so much damage. I came out of pharmacy in 2003, right? That was 2 years after the WHI study. By the time I'd come out of pharmacy, the seed had been sown and very little prescriptions for HRT were being written. And anyone that was on HRT had been taken off it. So I was dealing with women for the first 10 years of my pharmacy career coming into me, tearing their fucking hair out, wanting to know why they felt so bad, why they wanted to sucker punch their husband because he was breathing in the same room as them, why their desire was low, why their vagina felt like it was falling out. And there was no language around it either. We weren't really talking about the menopause. We definitely weren't talking about the perimenopause transition. So it was just this thing. And the damage that study or that announcement did is the shockwaves that it sent through women's health is just horrendous. And we're still living with it today. There are still women that are incredibly afraid of going on HRT, particularly if their mothers or grandmothers had breast cancer. And just by the way, to make it really clear to people, you are taken on an individual basis. Just because a woman in your family had breast cancer does not mean that you can't take HRT. And just to your point, the contraceptive pill was synthetic estrogens and progestins. Now they have body identical estrogen, which is so similar to the one that your ovaries were already making. As we age, our breast cancer risks increase anyway. Breast cancer is our cancer, it's our female cancer. And I think that women really need to kind of take into consideration, like, it's lifestyle as well. It's your weight, it's how much you drink alcohol, that is, it's your diet, it's your stress reduction, it's your sleep. All of that, is so important when it comes to our overall health and looking at it through a lens of unbias.
And vaginal estrogen, if I'm right, just back on the clitoris for a minute.
Oh, I love the way you say that, the clitoris. I call it the clitoris, but
Oh,
you do you.
maybe that's a very Canadian way. Clitoris. Oh, maybe I said it wrong. Clitoris.
No, you didn't. Do you know what? You're saying it, and that's the most
Just
important
say
thing.
I'm saying it out loud. I'm
Just
saying it out
say it,
loud.
girlfriend.
But the vaginal estrogen also is different than the HRT, right? Like you can still use that if you have had a cancer risk. Is that
Yeah,
right?
yeah, yeah. So basically, they thought for years that you couldn't take it, or they just said you couldn't take it because there was no studies or research done to say that you could. So let's just say no, you can't. Makes perfect sense, doesn't it? No.
Yeah.
But the thing about vaginal estrogen, and I'm just going to show you the different types that there are, and this is not exhaustive, but there are the little pessaries that go up into your vagina, and this is an applicator now, and you pop a little tablet into your vagina, and that's just the size of like a Tic Tac. There is a cream, and there is also like little bullets, like little with in oil-based bullets. So there are many options. There's also gels, and they work locally on the vagina and the vaginal tissues, and they work locally in the pelvic area. So they do not get absorbed systemically. They work there, do their thing, plump up the vaginal mucosa, make it healthy and happy again. They travel across the vagina into into like the urethra, the bladder, to help prevent the regular UTIs that many women will experience in this part of their lives as well. But they don't get absorbed systemically. If they do, it's very, very minute. Like, basically, what could happen if a woman is very atrophied and very dry down there, a very small amount could get through, at the very start while the skin is healing and plumping back up again. But once it's all plump again and it's not so dry anymore, it is fine. So the idea is that you use the vaginal estrogen as directed, which is usually one at night for 14 nights in a row, and then you reduce down to twice weekly for maintenance. But you need to be invested in it, and you can't be forgetting it, because then you have to go right back to the start of the treatment where it's the 14 nights in a row. Because what I would see women coming in is they get one course of it. They'll get a box of 24, which lasts them about 6 months maybe, because you have the first 14 days and then you have the twice weekly, and they'll go, oh, I'm healed, I'm cured. Stop taking it, and then they go back to zero then when, after a few months' time. So it's really important that women understand that estrogen ain't ever coming back, and it needs to be constantly replaced.
Yeah,
But
and that
women should be,
sorry.
yeah,
Yeah, no,
and
that's a perfect example of something that you would have to do for the rest of your life,
yeah, we
with
should
it.
be going into our coffin with a vaginal
Yeah.
estrogen inside our vagina.
I was just with somebody this afternoon, and she uses I guess she may use a gel or something, and she says she just uses it when she needs it, and she uses a lot of other practices, like a lot of natural. She's more natural in her approach, but it was really interesting to think of the estrogen as another complementary medicine. So even it's something that you're going to do for the rest of your life, but it's that vaginal estrogen is there to help you. It's another complement to the things that you're doing. There's no
Absolutely.
one
Yeah.
golden ticket.
No, and you can use a vaginal moisturizing pessary as well, like an oil-based pessary that just releases over time and just gives you a lovely glidey, healing feeling as well. Lubricant when you're having sex is really important, so you don't chafe yourself or get those micro tears. There's so much to it. So, like you say, we are doing as much as we can to help to treat ourselves. And the thing about taking HRT is, so you can take the patch HRT or the gel or the tablet, and that gets absorbed systemically. And that can really help with some of those negative symptoms, such as the hot flashes, the night sweats, maybe the panic attacks, or the fatigue, and that they can, and definitely it helps with the vasomotor symptoms, yeah. But a lot of the time, women find that they still have to use the vaginal estrogen or the localized estrogen, because it just doesn't quite hit it, Like, when you think of it, your pelvic region is a hub of estrogen receptors. And, when it's not getting fed estrogen that's been used to since you hit puberty, it's going to cause some troubles for you. So you'll know about it. It not necessarily happens with, you won't necessarily get all the symptoms or, get vaginal dryness, but you might get regular UTIs, or you might have a prolapse that just, it was there maybe after you had your vaginal deliveries, but you didn't realize it because it was asymptomatic. But then once your estrogen levels drop, your pelvic floor muscles decrease or they slacken a bit more, and you can feel that prolapse. So vaginal estrogen can help with so much. It can even help with anal itching.
Separately, as a separate idea. Not
Well,
related to
and
menopause.
no, it is. It is
Oh,
related to menopause,
anal
because
itching.
anal itching. So basically, if you think
That's a
about it, the
menopause
way
symptom.
it is a menopause symptom, and many women just treat it like they think they have hemorrhoids, or they think they have like worms, or they think they just have an itchy bottom and they use a bit of Sudocrem. In actual fact, what's happening to the skin in your anus, around your anus, is the same thing that's happening to your vagina. It's losing integrity, it's getting dry, it's getting itchy, and it's getting sore, because it's skin, and it's also fed with estrogen, and it also keeps it healthy. So vaginal estrogen cream applied to the anal area can just rectify that. And I've done a posts about that on my Instagram, and I had to actually use the term chocolate starfish instead of anus, because Instagram wouldn't, it would flag it as like, indecent
Yeah.
content, because I was talking about an anal itch, imagine. So, but the amount of women that got in touch with me and went, oh my God, I didn't realize that this itchy ass that I've had for fucking years is due to menopause. And oh my goodness, I'm gonna go to my doctor and get the cream. And then they message me like 2 weeks later and go, look, it's literally disappeared.
It's gone. This is what I love about this conversation, though. There's all these confessions, that all these things that women don't want to talk about to their friends, even never mind even tell their partner, that are happening, right? Like, can you imagine?
It's not very sexy to say I have an itchy arse.
Got an anal itch right now, babe. I mean, it's also the
Would you like a coffee? Would you like a coffee? Just wait until I scratch my my arse.
Wash my hands after. Oh my God. It's the first time we've even talked about it on this show. I knew you were going to bring it. You're going to bring it, Laura. I knew it. But this is the
I
stuff.
bring the goodies.
You bring the good stuff. I want to pause right there. While that's sinking in, let's take a quick break to hear from our amazing partners who help bring you this show for free.
I got a good feeling.
Quick favor before we start. I know every podcast asks you to do this, but could you please hit follow and rate the show? It really does make a big difference. Now, back to the show. We're going to jump into some of the stuff, but I want to ask you, what is in your office drawer? Do you have like a secret? You pulled out all those pessaries, all that. What else do you have hiding in there?
I have a little box of tricks, okay? Because you never know when you need your box of tricks.
Yes.
And I have everything in here. So I have a testosterone gel, just to show women what it is. I have a dildo, right? I have like a wand dildo, and then I have a clitoral stimulant. So because, like lots of women, they want to start having sex again, or they want to try and enjoy intimacy, but they don't know where to start. And if their vagina is so dry and sore that they can't even enjoy penetrative sex, clitoral stimulation is a really good way to start. So that's why I show them that there's a possibilities that doesn't necessarily involve just penetrative sex. And the partner loves it. They just want to have a bit of fun with you. And so I have that. I have your estrogen gel. I have some lubricant in there. I have I have just a vaginal moisturizer. So we have everything in here, because in case I'm on a podcast with an amazing lady like you, and you just ask me something, I can show you, because I think props really help people see that there's possibilities.
It's like, it's kind of like your little thing that you don't leave home without. It's like, don't leave home
No.
without it. Oh my God. Is that the ring pessary? Okay,
Yes.
we're going to talk about that. You got to hold on for 1 second. Okay, I'm going to jump ahead because I am going to ask you about that. So we know that the vulva changes like this. Hi, Laura.
Hello.
We know the vulva changes throughout life, okay? And then as hormones fluctuate, you've already touched on all the things that are happening down there in terms of thinning of the skin or dryness, whatnot. Are there early signs in perimenopause that women might dismiss as normal, but they actually need some attention? I mean, you talked about UTIs. When those start becoming a bit more, it's not just like, oh, I have a UTI. Maybe it's because my hormones are fluctuating.
Yeah. So regular or like frequent UTIs is considered 3 in a year is considered frequent. And that's a sign that there's something going on, that you need investigation. It's not normal to get regular UTIs. So you need to get that investigated.
Okay, did everybody hear
And
that? Not normal to
yeah.
have, if you have 3 or more UTIs a year, that is not normal. You need to go get that checked out.
Yeah. So peeing after sex is the best way to prevent a UTI. We know this, and I hope everyone does it. It's not terribly sexy, but just jump off or from under, go pee and then come back for a cuddle. That's a really good way of preventing. But if you're getting more regular UTIs, you need to have an investigation. It's not normal for you to be getting an antibiotic after antibiotic to get rid of the UTI. You're in this constant cycle of pain, antibiotic, pain, antibiotic. And then as women get older and go into postmenopause and maybe get a bit of dementia or Alzheimer's, they get delirium with those UTIs too. So there are so many women in nursing homes that just have regular UTIs. They get a bit of delirium, they're in pain, and then they get an antibiotic, and it's just this vicious cycle. But if they were on a program of vaginal estrogen, all of that would stop. But it's not happening, which really annoys me.
Well, and also, I mean, we had Dr. Tanya Adib, who's a consultant gynecologist on the show, and she even said, I'm a female gynecologist, and women still feel really uncomfortable. Like at the end of a consultation, they're like, oh, and by the way, I this is also happening. Like you've talked about with your experience as a pharmacist, it's kind of like
Yeah.
coming in with whispers. And hopefully now
Yeah.
that we're talking about it, there'll be a new generation of women that won't suffer.
Absolutely. Absolutely. And you'd be surprised once you go on a vaginal estrogen regularly. You just don't get your urinary tract infections, or what might happen women is they don't really even realize that it's helping them until they go on holidays, forget to take the vaginal estrogen, and they get a UTI when they're on holidays. So that can happen with women too. So yeah, that's why it's just so important to go and demand investigation and help.
Is there a question that women should not be afraid to go and like ask their GP? Or what would be the question? Or how is there a way to help women say, like, what's a good way into it? What's a line?
A line would be, my quality of life is being affected by this. Please help me. Because they're under an onus then to help you. It's not normal to go around feeling uncomfortable, dry, itchy, sore, unable to exercise, unable to run because you're leaking, not able to lift weights because you're leaking. Because don't forget, women are being told now, longevity, longevity, longevity. How do we make sure that we live longer, healthier lives, or that last 10 years is really, good and lived independently? The best way to do it is weight bearing exercises. We hear this all the time. Women cannot lift weights if they pee their pants. They just won't do it. So there's no point in telling women to do one thing when they can't even walk the length themselves.
Yeah.
So let's bring the two together by saying, look, if you suffer from incontinence, you do not have to walk around in big, thick incontinence pads every day. You don't need to wear black all the time because you're afraid of leaking. You don't need to know where the toilet is everywhere you go so that you can make a quick dash for it. There is help out there. Vaginal estrogen can help. If you have a prolapse and it's aggravating the incontinence, a pessary ring can help. There is surgery that can help. There are medications that can help. And that's why I wrote my book, because I just saw so many women not knowing A, what the symptoms were and when to go and get help, and B, who to go to for that help.
So I want to go through some of these. You've touched on a few, and I would love to go through and share a few questions or confessions that I read out of your book. And you can, I think you talk about them in your show as well, Viva la Vulva. And I'd love for you to tell everybody like what's going on and what we can do about it, because I think that's also, we're MenoPositive here. So it's not just like, here's what's going on in your body, but here's what you can do about it, because pain is not your destiny here. So
No.
shall I do that? Now, my very first question, Laura.
Okay, go for it.
You covered it already, because it was like, why is our clitoris shrinking? So that one is done. You got a big check mark there. Big check mark. Okay, you touched on leaking. And I think this is really interesting because many women, like, we've kind of started to normalize it and we laugh about it. Like, a little bit of pee comes out when I sneeze. Or like, oh, ha, ha, ha. Like, don't even get me to do a jumping jack. But this is not something we need to live with. And if it's left untreated, it can get more serious. So leaking, go.
So leaking. So just to be clear, right, you've my full permission to never do a jumping jack again, right? As a perimenopausal or a postmenopausal or post-baby woman, basically when you do jumping jack, you're opening your legs, which is leaving your vagina wide open, and there's pressure when you're coming down. So that is going to aggravate a prolapse if you have one, okay? So you do not need to be doing them. However, you do need to run. You do need to be able to walk fast. You do need to be able to, lift your groceries. So let's discuss how incontinence can impact on them, or how we can help ourselves. So, incontinence can be anything from a little bit of pee leaking when you say laugh or sneeze, that's stress incontinence, to full on flood, okay? Which is basically somewhere where you actually need to go and get, you really do need to go and have medical intervention there. But there are, as I said, vaginal estrogen can help with incontinence. You can have your pessary rings. There's a pessary ring with a knob that can shut off the urethra from leaking as well, which can be used too. It just has a little knob on the end of it that can be used for incontinence too. The prolapse pessary ring can be used when someone has a prolapse that's pressing on the that's just making that incontinence that little bit worse. Then there are medications that women can use, and then there's also then down the line, if they need to, there's surgery. So if it's impacting your quality of life and you are unhappy with it, it's really important that you get it seen to, because it will only get worse as you get older, because the more your estrogen levels drop, the more inclined you are to experience it. So keeping your pelvic floor exercises going all the time is really important too. And I hope you're squeezing while I'm talking, because that's when we often are reminded when someone just says it, but we should be doing them all the time. Or doing your yoga, when you're pulling in and it's basically like just sucking your belly button towards your backbone. Or like, imagine you are lying on your bed with your legs open, and there's a piece of cooked spaghetti at your vagina, and you're trying to suck that spaghetti up your vagina. That's a really good way of imagining. And
I
that's,
now
that's
have that
you doing your
visual.
pelvic floor.
Yeah, I now
There you
have that
go.
visual. Everybody's gonna hold on to that visual. But just back on incontinence, I'm just gonna slow it down just for 1 second, because I think, again, I learned in your book, and for everybody listening, 1 in 3 women will experience incontinence, and that number increases to 1 in 2 after menopause. So we need to take this seriously. And I love
Yeah.
you were talking about stress incontinence urge incontinence, and then you have this key in the door moment, which I think a lot of people like, you're fine, you're fine, you're fine. And then all of a sudden you start putting your key in your front door and you're like, oh my God, why do I gotta pee? What is that? Why does that happen?
It's your brain working. It's like an anxiety related thing too. So if you put the key in the door, that's your brain's trigger to like, okay, the toilet is near, and you can't hold on to it. So, but you can actually help yourself by counting backwards. You put the key in the door and you count 10, 9, 8, 7. So you actually take your mind away from it. So that there are ways and there are coping strategies, and pelvic floor physios can really help you with that.
Oh, and okay, so now I'm gonna move on to the pelvic floor, and you talked about a few of the exercises there. And do you follow she's the female physio Sarah on Instagram? She's in Australia.
I Probably not. But
She's
no,
got like
not if she's in Australia.
1.7 million followers.
Does
She's a
she?
young physio, and every day she just goes, "Hi, everybody. Are you ready for your pelvic floor exercises?" And she has this movement with her hand. She's like, and one, and two, and hold two. Anyway, she's brilliant. She just looks like so much fun and makes it normal. And she's like, okay, have a great day. And then she goes. But I've learned everybody talks about the Kegel exercises, but a physio can help you. There are way more exercises than just Kegel.
Yeah,
Like you're
absolutely.
eating the spaghetti one.
And
I'm
you
I'm
know,
guessing.
your vagina eating the spaghetti or sucking the spaghetti. I think that the important thing to understand is that if you go to a pelvic floor physio therapist, it's probably the best money you will spend on yourself ever. Everyone should go after having a baby, 6 weeks after having a baby, to get a little check, see where you stand. They'll do an internal on you where they'll stick two fingers in you. They'll be wearing gloves. They'll put a bit of lubricant on it, make sure everything's comfortable, and they will assess your vagina and see, are there any areas of weakness, and they will be able to tell you, yes, you need maybe a pessary ring, or you need a bit of vaginal estrogen, or you need to do these exercises. And there are, biofeedback TENS machines as well that women can use. So there are many options. So I think, a pelvic floor physio here in Ireland is maybe about €100 to go and see. And that €100 is probably the best money you'll spend on yourself, because they will give you a path to recovery. And the more and more vaginal deliveries women have, the more at risk they are of having prolapse, which can lead to that discomfort, that dragging, the feeling you have a ball in your vagina as you get older. So
Well,
yeah.
prolapse is this thing that I only hear, like I had only heard my elderly aunts talking about, right? Like that they had the women in their 80s and 90s, and that's when, maybe only because now they feel comfortable talking about it. They probably had it but never. But how many women will experience prolapse?
I don't know the actual statistics, and I'm not sure. I'm sure there are some, and I'm sure a pelvic floor physio could tell you, but I think there are so many undiagnosed prolapses, because you can have a prolapse and be happy out and not experience any symptoms. But it's only postmenopausally, when your estrogen levels drop, that you begin to experience the symptoms. So you feel like there's a ball in your vagina, there's a dragging, heavy sensation, particularly if you've been on your feet all day. So I'm not quite sure of the actual statistics, but I know there are enough. Like if you consider 80% of women suffer from genital urinary syndrome with the menopause, prolapse being one of those things, there are many, many women that will experience it.
So I like this idea of seeing a physio as a proactive approach just to managing your
Yeah,
overall health. And it's a
yeah,
pelvic floor physio. That's what women would ask for, right?
yes.
So that they're an expert in not just going to your physio who helps you with your knee when
No,
you fell
Jesus,
from skiing.
the physios that help you with your knee won't be able to help you with your vagina.
Okay, what about frequent peeing? Like like you're just peeing every half an hour or anyway.
Well, that's, overactive bladder. And again, it deserves its own care and attention. And you can get help with that. But again, you'll need a proper assessment. And the best people to do those assessments are your pelvic floor physios, or, your gynae might be able to help you too. But pelvic floor physios, they are in there doing this day in, day out. That's what they see. That's where they make their money. That is their bag. So I would recommend you go to one of them. And then if they can't help you, they can refer you on to a gynae if you may need surgery or not, for any manner of issues that you might have. But yeah, overactive bladder, another one of those things that women can experience. And with the proper care and attention, with either exercises, medication, many other pathways, they can get help.
So I want now you to come back to your ring of confidence, I think you call it. So that goes up your vagina?
It does. Now, don't tell me that you don't think that that'll fit in your vagina because your vagina is so small,
No,
okay?
I've
Because
just
it's
never
not
even
as small as you think. It's a big cave.
well, if a baby could come out of it, then I'm sure the ring can
This
go
is
in it.
it. But women think that it's not. There's no way this is going to fit. This is a medium size ring, so this goes up your vagina, and you go pop right, and it just at the top, where you're at the top of your vagina, it'll sit there, and it'll just hold everything up like scaffolding of a ceiling, and it can stay in there for like a year. It doesn't need to come out ever because your vagina is a self-cleaning oven, right? We all know that. So you don't need to even take it out for sex or after sex. It'll self-clean anyway. Now, some women do, they prefer to take it out, but you can leave it in for a little extra je ne sais quoi during sex if you want. But yeah, this basically goes up into the vagina and holds everything in place. So if you think of
That's
your pelvic
amazing.
floor as a hammock, so your pelvic floor muscles are a hammock, right? And they will kind of slacken as you get older with the lack of estrogen. And as a result, then your pelvic organs can fall into your vagina because your collagen is decreasing. So the walls of your vagina can get a bit softer too. So your uterus or your bowel or your bladder or all three or any number of them can fall into your vagina and give you that dragging sensation. So when they do that, it feels really uncomfortable. So if you pop one of these in and like a scaffold, it just holds it all up. So this can be a really beneficial medical device that women can use to help to either avoid surgery of the pelvic floor or reduce the need for it in the immediate term and maybe, push it out a bit for a few years.
Yeah, and if you
Because
go
those surgeries don't last long. You do a surgery and you may need to get another one within 5 to 10 years. Like they're not, they don't do a pelvic floor um repair surgery and they last a lifetime. You generally need more or else.
does the physio put that in or do you put that in? Like, does
So
the
so the
individual?
the physio will teach you how to put it in. First of all, you have to be fitted for it because we're not all the same size. So you need to be fitted for it, and then the physio will teach you how to put it in and how to take it out, and then you can do it yourself. Or a gynae nurse can do it, or your GP if they're familiar with it and do it all the time, or your gynae doc. But as I said, your pelvic floor physio does it all the time, so they would be like, a really good sounding board.
And you also, said maybe a little Botox could help too.
Yeah, so
Sometimes a little
Botox can
Botox.
help. Botox can help in the bladder area as well, sometimes too. And the only thing about Botox is a bit like the face, it wears off. So you need to get it done regularly, like every 3 to 4 months. Usually the first time it works is the best. And then results may vary. But yeah, it can work too. So, there are options for ladies. So important that they know this.
And, from all the work that you've been doing, do you really see a confidence shift when women finally start to understand what's happening in their bodies and then kind of take control of their health and know that they can do
Yeah.
something about it?
Yeah, confidence, empowerment. Do you know what as well? People's partners. So let's just take it that there's a male partner. Whenever I do a talk, and if there's a man at the talk or a few men in the audience, inevitably one or two will come up to me and go, I wish I knew this 10 years ago. I could have been such a support to my wife. Like men just want us to be happy too, because if we're happy, generally the whole house is happy. So, we need to be talking to our partners more without a doubt about this, because if we don't know our bodies, how the hell can they know our bodies and help us? But if we talk about it with them, they just want to understand and learn and help us. And if it helps their sex lives, they're even happier.
Tell us the story about you. I think it was in one of your talks, you had a 70-year-old that came and saw you at the pharmacy counter who was,
Yeah.
tell us that lovely story.
Yeah, so basically, the reason why I do all this is probably precipitates back to this one lady who's probably representative of loads of ladies that come in, but this one lady stands out in my head. And she came in for her third tube of thrush cream in as many weeks. Okay. And I said, listen, this isn't thrush. If you need 3 tubes of it, you should have cleared it within 10 days. Plus, you're like postmenopausal. It's quite unusual for you to have thrush unless you're on a vaginal estrogen. So I had a little consultation with her. It turned out that she'd been experiencing irritation, dryness, pain, soreness down there for many, many years. She couldn't go to the toilet and wipe. She had to spray herself down because she'd get paper cuts from wiping. She couldn't ride a bike. That was her main form of exercise. She hadn't been intimate with her husband in many, many years, and she was pretty miserable. But she just said to me, well, the cream kind of soothes it, for a time. So I'll just take that, please. And I was like, absolutely not. You're not taking it. I need to send you to the doctor. Your doctor needs to examine you. And she said, why would my doctor want to look at my 70-year-old vagina? And I just thought that she's representative of so many women that feel that their intimate health just isn't important. And, that they don't value themselves. So I told her he absolutely did want to look at her vagina. It may not be on his Tinder profile, but it was in his job remit. Off she went. She got the product and she was using it, and her vaginal estrogen and estrogen cream as well. So anyway, she got sorted and she was back within about 3 weeks. She was back comfortable walking again, like not uncomfortable. She used to say that she'd have to sit on one bum cheek sometimes to alleviate the pressure on her perineum and that. So she was back doing that after about 3 weeks. She was back riding her bike after about 3 months, back, to this bike club that she had been with, and back riding her husband about 4 months later. So she was a very, very, very happy lady after that. And her husband was even happier. He sends me a Christmas card every year.
I love it. I
So,
love it. But an
yeah,
inspiration, again, if you don't look after these things, what's going to happen? So,
this is it. This is it.
Laura, you've been like speaking to a best friend. So the final question we ask all of our guests, knowing what we know now about our vulva and the menopause transition, what would you tell our 35-year-old listener?
Get a mirror out and have a good look at it.
What
Get a picture of your vulval anatomy beside you and figure out where all your bits are and know exactly what everything looks like, so you understand that when changes start to happen, that you need to go and get help.
what would you tell our 45-year-old listener?
Seriously consider using vaginal estrogen or a vaginal moisturizer, and definitely use lubricant during sex.
It's for fun too.
I've never known any partner turn around and say, oh no, we couldn't possibly use lubricant because that would be too much fun.
And what would you tell our 55-year-old listener?
All of the above.
All of the above. I love it. Laura Dowling, thank you so much for being part of the MenoPositive community. Where can everybody find you? They can find you at Fabulous Pharmacist, right, on Instagram?
Fabulous Pharmacist on Instagram and Facebook and TikTok. And I have a podcast called The Laura Dowling Experience, where I discuss all kinds of issues, not just menopause, it's, everything. And my book, Love Your Vulva, is everything that you need to know. A beautiful, helpful, humorous guide to your vulval health, your intimate health. And I called it Love Your Vulva because I'm not going to shy away from the actual name, even though someone has asked me, do you really think women are going to go up to a counter and buy that, in a bookstore? And I say, yes, they will, because they'll be empowered to do so.
And for everybody listening, yes, I mean you, I want you to remember, your body is intelligent. Every headache, body ache is information. They're messengers. Did I drink enough water today? Is that why my head hurts? Maybe I didn't get enough sleep last night. The same with your vulva. When something is out of balance, the changes you're experiencing are her way of getting your attention. Respond with care, curiosity, and hopefully now with confidence that you can handle whatever comes up. See you next time. And don't forget to love your vulva. Bye. Oh, and by the way, I knew you were menopositive when you downloaded this episode. Thank you so much for joining me today. I love bringing this information to you, and I love that you're taking control of your health. You can follow MenoPositive on Instagram, TikTok, and LinkedIn. If you haven't yet, please subscribe, rate, review, and share this podcast. Join me next week as we discover more ways to optimize our bodies. Because together, we're going to redefine menopause.
I got a good feeling.